excited to share. I will be talking with Shellie Fidell, who was my postpartum therapist after I had my first daughter, Kira. So welcome to the show, Shellie.
Thank you, Kira. It's so nice to be here.
Yeah, how are you?
I'm doing well. I'm doing really well. How about you?
Good. Yeah. Do you mind sharing with them who you are, what your background is, and what you specialize in?
Yeah, no, I'm happy to. So my background is I'm a licensed clinical social worker and a psychotherapist. I started off back in the late 90s in medical social work. And so I started working down at Barnes-Jewish Hospital as a medical social worker. And then as managed care came in and we got to spend less time with patients and more time doing discharge planning, I really decided that's not my forte. I want to be doing more clinical work. So then I went into private practice and started working with groups of women that were going through postpartum depression, and I did individual therapy and group therapy for postpartum moms. And then over time started realizing, gosh, this is so much broader than just postpartum. We know so many women experience these same symptoms during pregnancy, and then there's so many women out there who are having trouble getting pregnant. So I started to work with infertility, and then I realized, gosh, there's so much more to do, and I went back and did postgraduate training at the Psychoanalytic Institute here. So I really love what I do. It's kind of followed my life's work in terms of my own interest and my passions, along with, get to meet great people like you.
Oh, you're so sweet. Well, I'm so happy you're here today. This topic, these postpartum, pregnancy, anything to do with motherhood and parenting, I think for a long, long time, correct me if I'm wrong, in prior generations, maybe we didn't talk about these things.
Yeah.
And women were just having to grin and bear it.
Yeah, suck it up. Yeah.
Suck it up.
Suck it up. And I used to hear things like that from partners that would come in and say, I don't get why she can't do this. My mom raised 5 kids, and can't she just pull herself up by their bootstraps and get on with it? And, back then I think they used terms like she had a nervous breakdown. Maybe grandparents, when you would get a history from someone. Well, I think my grandmother had a nervous breakdown. Really, how long after having the last child did she have that nervous breakdown? And often they were probably postpartum episodes with no understanding, a lack of information and support for sure, and then other toddlers running around the house. So not only did you not have time to care for yourself, but you had all these other people to care for. So yes, we didn't have a name for it. We didn't have treatment for it. And you felt really isolated and alone, and like something was wrong with you. You were not meant to be a mom. You were a terrible mom. These were these messages that these people were suffering with alone.
Yes. And, since becoming a mother, I found out that my grandmother, who actually had 9 kids, one passed away at stillbirth, so my dad's side of the family, come to find out my grandma, who, God rest her soul, she's in heaven, we adored her, but she was on volume.
Yeah.
It's like, after I started having children, was like, hey, what's going on here?
Yeah.
I'm losing my mind. This is all so stressful. And my aunt was like, yeah, well, I'm like, how did grandma do it?
Yeah.
She was on volume.
Right, yeah.
I'm like, no wonder.
Well, and you know what? That was probably benzodiazepines were the only thing that was the one thing they could give women is just keep you a little more sedated. It'll take the edge off, honey. But what it wasn't it gave you a little bit of relief, and then it wears right off. And then the next day, you're feeling the exact same way again. So yeah, it wasn't until, gosh, I don't know the exact dates when they were released, but like the new medication of SSRIs, so selective serotonin reuptake inhibitors, things like Zoloft, Lexapro, Prozac, those were medications that were being studied so that we knew that we could safely use them during pregnancy and nursing. We could tell people that, yes, there is help. It's not a pill that's going to make you instantly feel like Valium or Xanax or any of those kind of quick fix ones, but it's going to help you along with talk therapy. So that was the other thing, introducing the idea that this isn't just a lack of character or lack of strength. This is about hormones. When you're pregnant with those kids, your progesterone and your estrogen anywhere from 10 to 100 times the normal amount. So you deliver the baby, deliver the placenta, and your hormones plummet. So number one, that part, the hormonal shift. Then you've got sleep deprivation, which, as we all remember, that's how we tortured prisoners of war, right? Is deprive them of sleep. So we add in sleep deprivation. Then we add in the fact that for most people, this is the first time they've been responsible for another human 24/7. And it's like being promoted to the president of IBM without ever working a computer. And suddenly all of this responsibility falls on you. So it's the perfect storm. And then if you have a history of depression, anxiety, a family history, a personal history, if you went through fertility treatment and had all those hormonal shots in your system, that makes you a little bit more at risk for having postpartum. And perfectionism, which so many of us, we want to strive to be the best that we can be. Oftentimes that can mean maybe type A personality, perfectionistic expectations of ourselves, and all of those things contribute to what we know as can be postpartum adjustment, or even more severe, like a depressive episode.
Yeah, and since I've been open about my story and my journey, a lot of my friends have also said, well, yeah, I had those same feelings and those thoughts. And just for our viewers, I'm very open and vulnerable about our story, because I believe if we all speak our truth, then it helps us all know we're not alone. So if we can walk down my journey and when I came to you, a little history, as you know now, because we spent many years together. Yeah. My mom passed away in 2013. So I haven't had my mom throughout, my engagement, my wedding, my children, any of the big events. So I really, moved to St. Louis, not really knowing that many people. Yeah. I knew people from college, but moved here for my late husband, Kyle. And he was 40 when we got married. I was 30. Both of us had careers of our own. And we got married and started having children pretty quickly. Yeah. And so I started experience, I think, while I was pregnant. I think I had a history of depression and anxiety, and I just, I used to run marathons and do triathlons, was a high achiever, traveled a bunch. And then when I got married and started having children, my whole life changed. All beautiful, amazing things, and I'm certainly grateful for everything. Yeah. I'm grateful for my past, present, and the future. But when I had my first child, my husband worked full-time at Edward Jones, and I didn't have any help. We had no family here, nobody. We hadn't hired a nanny yet, but I had been asking if we could have one. And I was waking up every day with severe chest pain. Yeah. I got mastitis, which some of you may or may not know. It's when you're trying to nurse, sometimes you're, how do I say this?
You can get an infection in the milk duct.
Milk duct. There we go. An infection in the milk duct. And that happened where you basically get the flu and it's like fever and it's painful. So nursing wasn't super easy for me the first go around. But in my mind, I had in the back of my head, nurse, of course you're nursing.
Of course, because breast is best.
Breast is best, correct. That was this plate, and I'm like, I can do this, so I probably started seeing you, 3 months postpartum?
Yeah, probably.
Finally, my husband and I were like, something has got to change. Like, I don't want to wake up every day feeling so stressed. So my doctor, my OBGYN, I called several times into there saying, this isn't right. I don't feel normal. And she's like, why don't you meet with one of the best postpartum therapists? And thank goodness you had an opening. Yeah. So let's talk about, I come into you, and do you remember what, I was a hot mess.
Yeah. Well, you were, we would say you were very acute. So, sometimes these symptoms kind of develop over time. And I will see women that are coming in with a 1-year-old, and they've been kind of silently suffering. Other times, like yours were very acute. And especially when you're having the symptoms that are physical, cardiovascular, heart palpitations, that's a pretty big red flag. It's hard to ignore, which is good in a way because you get treatment more quickly when you're in that kind of acute pain. Obviously, first we want to rule out that this isn't something physical going on. So, getting you to see your primary care or your OBGYN to say, okay, because there are disorders that can happen after having a child that can also cross over the symptoms. So once you know that, okay, no, everything checked out physically, then let's look at how powerful our mind is over our bodies and creating these symptoms that feel like you're having a heart attack and feel like you are going to pass out because sometimes people have lightheadedness. For you, you were such an overachiever. You were probably having these symptoms way earlier, but you channeled them into exercise, fitness. It's a wonderful coping tool. However, sometimes, I hear this from runners often. I need to go for a run. If I don't go for a run, I don't feel good. So it's probably some sort of an internalized feeling, and then you go for a run and your anxiety goes down. It's wonderful, it's healthy, until it can't work anymore because maybe the anxiety is too much and the run isn't taking care of it, or you don't have access to running. And you're going through mastitis, which is so painful. And then, like you mentioned, without your mom. So having a village around you is so important, and a supportive one, because sometimes you can have family, but that family maybe isn't what you need them to be in terms of support. Sometimes they can add more stress to your life. So, but not having your mom there, and that grief can actually kind of resurrect during that time. It's like another wave of grief because you're missing her in a completely different way than you did before. So I remember that for you being really significant too.
Yeah.
Yeah.
And I tried to ignore it and, reduce my caffeine intake, all the things, but mine had just exacerbated out of control.
Yeah.
So finally, Shellie and I don't know how quickly, but you finally convinced me. I was very apprehensive to go on medication, which, I think for a long time, medication was faux pas, right? Like
stigma, kind of insane,
Correct.
Especially in the Midwest. I feel
Yes.
like even therapy in the Midwest was very like hush hush, like I'm going to see my therapist. You go see your physical therapist, occupational therapist, no problem. But if you went to your psychotherapist, everybody would whisper because it's a little bit more conservative here. Thank goodness that's changed.
Totally, yeah. I remember I had heard someone about me had said something's wrong with her. There's something, there's something wrong with her. Yeah, I had just had a child with zero support, undiagnosed, untreated anxiety, and then it exacerbated.
Yes.
And my husband didn't know what to do. He never had a child before.
Yeah.
We had just gotten married. He never even had a spouse before.
Yeah.
And so he was like, took some time off initially, but went back to work.
Yeah.
And then I just was left and I didn't feel comfortable every day. And finally, I was apprehensive to medication because addiction runs in my family, as it does a lot of families. And so I was so scared to death.
Yeah.
Do you remember this?
Yeah.
To take medication.
Yeah.
And you were so kind and gentle and patient with me. And what you said to me and what I've shared with other people is anti-anxiety medication simply turns down. I mean, I can picture you in your office, Shellie, as I'm like looking over the hospital, turning down the anxiety. It just simply lowers the volume. And I was like, that's it? Like, what? I couldn't comprehend it.
Yeah, because these medications, I think there's a lot of misinformation out there, like that they're addictive or you can't get off of them. I hear that a lot. Like, well, I don't want to get on because I've heard it's so difficult to get off of them. Well, yeah, I mean, you have to taper off and you have to go very slowly. However, they can be life-saving, these medications.
Saving and changing.
Yes, life-changing. And they take about 2 to 3 weeks sometimes to work. Sometimes they'll work much more quickly. But I always say they're not going to make you feel happy or high. They're not like that. They lessen the symptoms of anxiety and depression. So slowly you'll start to recognize, okay, I'm feeling like I can take a deeper breath. I can feel like I have more frustration tolerance with my child. I hear her crying and I don't feel like I literally want to jump out of a window. Instead, it's like, okay, I can just respond, not react. So the medicine, and they're not perfect. They do have some side effects. So we, talked about those, but it's weighing the cost and the benefit. And for so many people, these medications, I mean, if you can't eat which for a lot of people with severe anxiety, their appetite plummets. Well, you need nutrition to fuel your body. If you are trying to nurse a baby and you have zero appetite to eat and you also are barely sleeping, your milk production isn't going to be there. And then you feel bad about that. And that's why when I said breast is best, I was joking because obviously fed is best.
Fed is best.
Fed is best. But not that long ago, there was such a strong push that if you couldn't breastfeed, okay, well, that's already, you're not doing what's best for your child.
You're not living up to the mother that you should be because your body won't produce, which is such a false statement. There are so many women that aren't able to physically, mentally, emotionally do that.
Yeah.
And it's easy for me to say now, my oldest child is 7, just went off to the first grade, but, I've had some really close friends who, one of my best friends had cancer. She literally, and you know her actually. We were able to, I don't know if that's HIPAA or whatever, but, luckily you were able to counsel them as well, but she couldn't hold her own baby nor nurse.
Yeah.
And never would I ever want anybody to feel bad about that. Because
Right.
there are amazing formulas out. Clean
Yes.
formulas out these days, and fed
Yeah.
is best. No one, and I always use this as an example. I think we talked about this. My niece and nephew on Kyle's side were formula babies because their mom couldn't produce milk. The kids were both for Victorians, D1 athletes.
Yes.
One of them's in the NFL right now.
Okay, yeah. So clearly that formula didn't hurt them too much. Yeah.
I don't think so.
Yeah. I shared the same story because I couldn't either. And my 29-year-old just finished grad school and somehow was formula fed and actually finished graduate school and has a job. And, so it's like, I feel like giving ourselves a break and then talking to ourselves like we would talk to our best friend. Like when your best friend calls and says, I can't do this, you would never shame her. You would just say to her, you are the best mom. You're giving your baby what your baby needs, which is you and love and protection. That's it, you know? So, but unfortunately, we can talk to our best friends a lot more kindly and gentler than we talk to ourselves.
Yeah.
Yeah, that critical inner voice really can bully us.
Yeah, Shellie, and then can we talk about how if you, like I did, wait. I got to the point where I was having insomnia, and I think you referred me to Melanie McKean.
Yes.
She is
She's a board-certified psychiatrist in perinatal disorders. So.
Yes, so she and Shellie became my team and convinced me to try medication.
Yeah.
And it was an absolute game changer. But I did get to the point. So can you talk about what happens when you let these symptoms exacerbate and keep putting it off to where the point insomnia takes place, intrusive thoughts?
Yeah. So, and then also if you have a tendency to be a ruminator, somebody who, and often anxiety can manifest in different ways. For some people, we hear OCD and we think washing our hands, but that's just one type of OCD where your phobia is germs. But for a lot of people, and especially postpartum moms, OCD can take the form of worrying about your child or worrying about you and your own health. And instead of it just being a thought of, oh, I wonder if the baby is sleeping, it's the anxiety grows and grows and grows till you have to go in there and physically check, make sure, that they're breathing, then go back, then your anxiety goes down temporarily until the thought comes back, which can be very quickly, perform that ritual, go check again. So there are people who are not sleeping in 2 years. I mean, where they're just going in and out of their baby's room, checking all the time. And of course, checking once in a while is one thing, but when it's disruptive to your ability to take care of yourself, and sleep, as we know, is a major one, then that's when we are going to try to push a little bit more to try some medication, because after you go days and days without sleep, you really do run a risk of having a more serious complication. Yeah.
Yeah, and truly, I'm so grateful, y'all. I think it was 7 or 8 months postpartum that I decided to try anti-anxiety medication, and it changed the trajectory of my life and my kids' lives.
Yeah.
I mean, and I wouldn't change it for the world.
Yeah.
I mean, I'm just so grateful that I finally took the leap and
Yeah. Do you remember how long it took you to feel better? Did it take a few weeks?
A month or two, maybe, I think.
Yeah.
And
Because to get up to a therapeutic level, we always like to start people at a small dose so that they can build it up in their system and not have the side effects. If we started you right at a higher dose, then you're going to have more side effects.
Well, and I was more OCD about it, and, I was really nervous about it, and, I was apprehensive to take Xanax or, what's the other one, Ativan.
Yeah.
But finally convinced me that when I have those almost panic attacks, to take it. I mean, I remember calling you on the phone and being like Shellie, I'm, and you were like, just take it, Kira.
Yeah.
Just do it.
Yeah.
And finally, just knowing that is there to help, and it's not for forever. And weaning off is not that big of a deal. It's like we make this big deal, and another thing, Googling,
yes.
Google is not a new mom's best friend, but I was up all night Googling, and then I was researching every medication and what it's going to do and the side effects. And then you go on these blogs of people talk, horrid.
Yeah. Yeah.
And I'm like, you know what? She probably should have just listened to the professionals.
Well, but I get it. I mean, we all, when you have access to this thing, Google, and you want to feel like you're doing due diligence. I'm doing my research, but that research can work against you in the sense that you're going to encounter people. Often the people who tend to spend a lot of time are people who actually didn't have good reactions. The people who took it, did well, and moved on with their lives, they're not on boards. They're really, they're just...
Well, and then there's also the risk of, are they taking it? We don't know if these people on the internet are taking it correctly.
Correctly, yes.
The right dosage,
right.
all of the things.
Forgetting.
Correct.
Because, for a lot of people, this may be the first episode they've ever had in their life of a significant struggle. So they're not used to taking medication, and and people think, oh, well, I'll remember. No, you don't. You've got a baby to take care of.
I still don't remember,
Yeah, a lot of times people don't take it regularly. So getting those pill boxes, the ones you see, Walgreens, Monday, Tuesday, Wednesday.
Yes.
Those, I started just buying them in my office and handing them out so people would use them at least to start to form the habit of taking them. And and then the side effects that people worry about often, those don't happen to everybody. So, I feel like getting over the stigma of medication, getting over the stigma of talk therapy, those are those kind of obstacles that you have to do initially to get the help you need. Right. And it doesn't mean it's going to be a long thing. I think people sometimes think, oh, I'm going to be in therapy for forever. No, not necessarily. If you want to, because some people just are more insight oriented. They want to know more about their motivations. Like you are always curious about that. But some people are like, just get me back to work. Like, I don't want to do this. Yeah. So it can be brief, short-term therapy also.
Right. And just not to be afraid of having that team when you're having a baby in those first couple years, whether it be a therapist, medication, your family and friends, a nanny, someone to cook for you or do your laundry if you can afford it.
Right.
Because there are options, and it's not one size fits all.
No.
Right?
Right. So again, like we said, some people are very blessed and they have like a lot of family in town and they already have it set up where when, the cousins are all, on a meal train where they're bringing in stuff. But for a lot of people nowadays, I find that people, have moved out of town and they don't have their family here. And especially in a town like St. Louis where a lot of people do, it's hard to not have that because you see other people at drop off that seem like, oh, well, her sister's in town and her mother's picking up, and you feel envious of like, where is my support? And so it is hard when you don't have that. And then you demand more from your spouse. And that can be really challenging because we talk about postpartum depression with moms, but dads can get it too. And then if you're both struggling and you don't have a lot of support, it's like you feel like this ship is going down.
Real quick.
Yeah, right.
Can we talk more about that with men? What can you give us a little insight on that? Because I think that's definitely not on a lot of people's radar.
Yeah.
But you hear it, right?
Yeah, we're starting to talk about it more so. I mean, obviously the hormonal component isn't there, but the other risk factors of sleep deprivation, a history of depression and anxiety, for some men, if they were the sole provider or the main breadwinner per se, they may feel like, oh, I can't take off time from work. So whereas we talk about maternal leave, family leave, paternal leave, there was almost a stigma against men utilizing. Now, I think that's changed now, but it used to be like, well, maybe we have a paternity leave, but are you really going to use it? You know, kind of like if you're serious about climbing the corporate ladder, you're not going to use that. But for so many people, they need their spouse there with them, because then at least they know that at some point of the day, I'm going to be able to hand off the baby. I can maybe brush my teeth. Maybe I can get a shower. Maybe I can get a smoothie. And I mean, that was one thing I remember with you is smoothies, because it's difficulty eating at the beginning. When you are so anxious, it's even hard to chew food. So getting your nutrients and getting calories in through smoothies and protein shakes may be your only source. So, but access to those. So it's like having somebody, when people say to you, what can I do? I'm like, drive through Smoothie King, bring me a protein shake or something.
Yes.
Yeah.
Absolutely.
Or boil a dozen eggs.
Yes.
And peel them for me and put them in a
yeah.
Ziploc bag.
Yeah.
Yes, I don't need another lasagna. No one needed another lasagna, but I could certainly, you could do a lot with a dozen eggs. Yes.
I remember some of my girlfriends made these from home. They drove up to see me and my, babies, and they would make like those protein balls with almond butter, dark chocolate, oats, protein, and then I mean they were delicious.
Yeah.
But yeah, I had some really close friends step up and help because I didn't have the the parental support.
Yeah.
But I want to make sure that people know that they're not alone. That just because someone maybe they look polished now.
Yes.
Back in the day, we're all a hot mess.
Yes.
And can we talk a little bit about the infertility piece? I know for me personally, I didn't struggle, and I'm forever grateful. I've had different struggles in my life.
Yeah.
But the infertility piece is, really a lot of women struggle.
Oh, so many. And for many reasons, but one of the major ones is that women are delaying childbirth till later because we're focusing on our careers. And so maybe in their 30s, just kind of meeting a partner and deciding like, okay, I'm really ready for this next stage. And I work with so many women who go into this hopeful, and then they realize, gosh, I have this diagnosis of like whether it's diminished ovarian reserve or the quality of their eggs they're not producing pregnancies. And now we're going into a whole area that becomes very expensive. It becomes very emotionally draining and physically scary because you're starting into this world of fertility and shots and procedures and the idea that you're seeing all your girlfriends around you seeming to get pregnant. And then suddenly this thing that seems to happen naturally for everyone else and you want so badly is not happening for you. And it's really, really difficult. I
can only imagine.
Yeah. I started working in that area after experiencing fertility struggles myself. And the isolation you feel and loneliness when you're going through it. Hopefully nowadays there's so many more resources, certainly online, than there ever were. But the idea that people are talking about it more. There used to be a stigma about that too. And now women are like, no, we're going through IVF, or we're going through just starting with fertility, or even they have now, you can have donated eggs where you get an egg donated. They have embryo donation. So couples that have maybe gone through IVF and their families are complete, they have embryos in storage that they aren't going to use, so they donate to another couple who's going through fertility. I mean, the opportunities are there now that weren't even 20 years ago.
Yeah, thank goodness.
Yes.
Thank goodness people are talking about it. These are real life things.
Yeah.
These are, meeting the spouse, whoever you choose to marry, and having children, starting a family. It all seems so beautiful and glorious, and there's a white picket fence, and the sun's always shining. But the reality of it is that that's not the case for most people, at least initially.
Yeah.
And even, can we talk about that dynamic between, this the people involved, you know, the mother and the father, whatever your family looks like, you know, if the woman's going through infertility, like the husband, you know, like I have friends that just got married, older as well.
Yeah.
And the woman's going through infertility, and it's like the husband has no idea.
Yeah.
And she's hormonal and going on, you know? And so it's like them as a new married couple, or even a couple that's been married or been together.
Yes.
Like the friction that can cause there.
Oh, yeah. And same-sex, I work with a lot of same-sex couples.
Yeah.
So even the person who is not carrying the pregnancy,
Right.
but who did all of the shots, and the other spouse, even though she's another woman, she's feeling like, I don't know who, you know, who this is. So it's really can be very challenging. And you're right, the highlight reel that we see on social media when someone does their gender reveal, it can look like everything was it just happened so beautifully and naturally. Yeah. And I really encourage people to take breaks from that social media thing, because it's triggering enough just to live in this world and have to be exposed to when you're trying to be pregnant and you see a pregnant woman walking by, that can just derail your whole day. But when you're on social media and people have a right to celebrate because they're happy that they're celebrating their highlights, but sometimes you need a break from that. And so just like limiting the amount of exposure you do to triggers can be helpful when you're going through this. Yeah. Absolutely. But yeah, the friction that it can cause between spouses where it's like, I don't recognize who this person is, but we're shooting them with a lot of medication because we want them to produce more and more eggs so that when they retrieve those eggs, that they can have the opportunity to have more good quality embryos. And sometimes people have to hide it because they have family members that, for religious reasons or ethical reasons, feel like you shouldn't be doing that. So then they feel judged by their family. So they are going through this, but pretending not to be going through it. And
there's just so many layers.
Yes.
You know, and the end game is, again, to procreate and provide a life to, you know, like what are we all brought here to do? You know, do well by others. And, you know, I believe I was meant to have these 3 children. But Kyle and I struggled when we first had kids because he was like, who is this woman I married?
Yeah, it was such a short time, too, that you guys were married before you started becoming parents, that it's like you didn't really have that grace period of like, let's just have fun.
And be husband and wife.
Husband and wife, yeah.
But I mean, I remember him saying, like, I don't know who you are. And I'm like, you know what I mean?
I don't know who I am either sometimes.
I know who I was.
Yes.
But now, you know, and all these hormonal, just like the anxiety and you just feel helpless. You're like, I am who I am, but these feelings and thoughts are not me, but they're real.
Yeah. And we all do things differently also. I mean, when some people are feeling that way, they go silent. And for others, they're
Withdraw.
Others are like, I need help. Help me. And just even that difference, you know, it's the family dynamics. Often spouses come from very different family backgrounds where we are stoic and quiet and
don't talk about any issues, and everything's under the rug and everything's fine.
Yeah.
But in reality, it's a hot mess.
Yes. Right.
Whereas like other families, like mine's like, we are who we are.
Yeah, right.
You know?
But when you marry someone who doesn't come from a family like that, it's, you know, it's not the Brady Bunch.
It's not the Brady Bunch.
No.
And I remember you saying, like, in the back of our minds is a tape playing of our upbringing, essentially. And so if 2 people are coming together to create a new life, and of course we want to bring stuff from our upbringing that we like, but there are things that we don't. It's hard to rewire.
Oh, yeah.
Right?
Yes. And it's hard to not be defensive about, okay, well, my way's the right way. Your family's messed up, and that's why. And even those words labeling, your family's nuts, your family's that I think is right there can start a lot of problems. Because what do? You get defensive. Someone's attacking you or your family, you defend it. And the same thing, whereas if we can recognize, like, okay, hey, we both came into this marriage with really different backgrounds. That's why we were attracted to each other. Something drew us together. How can we move forward and try to kind of have a little distance between, first of all, choose kind words. Anything that's like below the gut, like sucker punches, those aren't useful. People do them, but they're not useful. But learning how to say to the person, okay, time out. We've now gone into this ugly zone. Let's take a minute, take a break, and let's talk about this later. Because those words are hurtful.
They are hurtful.
And you can't unsay something.
Right.
You know?
Right.
Yeah, so.
Yeah, I think a lot of us go through that. And another thing I was thinking about, because I learned so much from you and from Dr. McKean, and I'm so grateful that I had a team to get through this, because we obviously quickly had Leah after, and then Dane, and then Kyle's diagnosis.
Yeah.
So I am so thankful. I mean, you're the first therapist truly I've ever had. I mean, back in high school, I went a couple times, but it was a joke. And then shortly after my mom passed, but it wasn't into her either. But can we talk about hormones in women, not even infertility, because we know there's a lot of hormone injections there, but the first 12 to 18 months after a woman has a baby, what's happening?
Yeah, I mean, and it's different for everyone. So I don't even know if I know that answer from a medical standpoint of what's going on for everyone. But I just know all the different variables from hormones to the other factors like nutrition, like sleep, like exercise, and the fact that maybe if you're nursing, you're not able to run like you would have in the past, maybe. I mean, some women can, but others, it's just uncomfortable.
Yeah.
So figuring out the hormonal piece of it, and then if we add in medication, how does the medication affect that? So there's just so many variables.
And factors,
yeah,
totally.
and factors that it's kind of hard to speak in terms of generalities. But I do feel like the team approach is one that a lot of people have been trying to get started in St. Louis for years. It's difficult to have a group practice. You want to bring in an exercise physiologist. You want to have a psychiatrist. You want to have therapists. You want to have childcare, because who's going to watch your baby when you come to see a therapist?
I had to bring babies with me.
Yes. Oh, yeah. And sometimes we would do phone sessions, and you would be rocking the baby with. I remember that. So it's where we say it takes a village. It would be nice to be able to have all those supports in place so that, and there are really wonderful places. I know there's places where moms would go for a support group for breastfeeding, and they would just be able to sit around a room with other moms. And because we as women, we're all wired to connect, I believe. But
Agreed.
As women, we tend to really get a lot of benefit from hearing each other's stories and supporting each other through it. And so I've done groups for years for postpartum, and just being able to sit around a room of women where no one is judging each other, and you can breastfeed, you can bottle feed, you can wear your baby, you cannot wear your baby, sit on the floor, don't sit on the floor. I see what happens in that room. There's this trust that starts to build, and then we slowly take the barriers down of admitting that we all are scared to death and don't really know what we're doing, and we're scared of not just even about the baby, but about financial concerns. Are we going to get moved again? The military. So a lot of spouses in the military, they know they're moving constantly, and there's a lot of support on that basis, but just moving is so stressful.
Oh, yes. It's one of the major stressors in life.
Yes, right.
And there are a lot of free resources. So for those of you who are dollar signs are showing up in your head, cha-ching, 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 there are a lot of free resources. You can find those online. Definitely ask your OBGYN or the doctor taking care of your baby or you during the pre and postpartum. But a therapist there are therapists that do work on a sliding scale based on your income. So there are therapists that can be affordable. I would say every last dollar, it was worth every penny to me. But I know that some people struggle financially.
Right, big time.
And I don't want to overlook that.
Absolutely. And there are, another thing that not everyone knows about is, so your insurance, you may have an in-network provider that you can go to for mental health services, but if, let's say, your doctor referred you to someone who's not in network, you still have out-of-network mental health coverage. A lot of insurances, not everyone, but a lot do. They don't tell you about it, but if you call the number on the back of your card, the membership number, and you say, I would like to see somebody who, and on my website, they're welcome to go. I have the questions that you want to ask your insurance
that's
provider.
So nice.
Yeah, it's just ShellieFidell.com. But you
Put
can
that at the bottom.
Yeah, and you can ask these questions, and I tell people, take notes, write down, okay, after I've met my deductible, well, what is my deductible? Have I met it? Oftentimes, maybe you've met it from the delivery of the baby. So then that calendar year, it's a great time to get started because you've already done that.
Yes.
So maybe instead of covering it at 80%, they cover it at 70% or 60%. But it's helpful. And like you said, often sliding scale is an option for people. There's group therapy at, I used to be at Missouri Baptist, and we had free groups that there was a breastfeeding support group, there was a new moms group, then there was a postpartum group. And those were very small nominal fees, and you could bring your baby to all of those. And I met a lot of people that said, yeah, I met my play group through that.
I went.
Yeah.
I went, yeah. And also, and I did this with you, Shellie, and I think Dr. McKean. So you were not in network. And so I called my insurance and said, this is the woman I want. I have tried other therapists. They don't work. And they were able to negotiate with you an in-network price. Do you remember that?
Yes, right.
So
That's
people,
pretty. That's not common, but they did. I do remember that now that you said
so
that.
if you're own,
Yes.
your own advocate, you
Yeah,
can
be your
work
own
with
advocate. Kira was very savvy, and she was like, "No, I want to." Yeah, and so they did do that.
They did. They
Yeah.
negotiated so that Shellie was paid directly her fee, and she was considered in network. So there are outliers. Again, you just have to be your own advocate. Call your insurance. Be, this is really important to me.
Yeah.
What else was I going to say about that? In network, I forget. But I did go to those free support groups, and they were really helpful.
PSI, Postpartum Support International, is a wonderful resource. Okay. There's a lot of resources there on the website. And there's lots of Facebook groups nowadays for women with postpartum. Because for some people, access is hard. If you live in a rural area, driving all the way there is hard. So that's why virtual therapy is really nice to be able to, I
mean, I remember being so nervous to get Cora into the car seat, into the car. It was the dead of summer, hot.
Yes.
I couldn't figure out how to open the stroller. I'm like, it's like 100 degrees outside. Yes. I remember taking her to Target, and I couldn't figure out how to get the stroller, so I just closed it up, put her back, and we went home. Because I was like, I literally am so nervous and anxious, I can't even take my child to Target. And again, not everybody experiences that.
Right.
But I think there's a lot more women who do experience that.
Yes.
Especially now with all the pressure that we have. A lot of us are working.
Yeah.
There's a lot of solo parents out there.
Not
everyone has
a spouse.
Right. Or even if they have a spouse, they don't do anything. They don't have anything to do with the baby.
Right.
Zero help.
Right.
And
They're
maybe
not
that's
helpful
how
for whatever
they were raised
yes.
or the arrangement you have. And so I just want women to know that they're not alone.
Yeah.
There are resources.
Not alone. There's help available, and virtual has really been nice for new moms. So after COVID, before COVID, there weren't a lot of people doing virtual. And then during it and then after, people are saying, gosh, this is great. I don't have to get a babysitter. I can do it during nap time, or I can feed while I'm in session and then the baby's occupied. I can, or some people will go for a walk and then do it audio. And that way they're killing two birds with one stone. The baby's happy. They get a little walk in. They get some
fresh air.
Vitamin D, fresh air, sunlight, and they get their therapy in. So it's kind of like thinking outside the box, I think can be really helpful.
Absolutely.
Yeah. And then the other thing I want to mention is we were talking earlier about, using alternative things like the infrared. I love using guided meditation. So often moms will say, I'm exhausted. Physically, I am exhausted, but I lay down and my mind starts racing. And that's an indicator too of postpartum depression and anxiety, is that when your body's so tired it needs sleep, but your brain won't let it. Yeah. So what I like to do is tell people, keep like a notepad on your nightstand and a spiral notebook and just start purging all the noise in your head. not even with the light on necessarily, because you don't really have to be able to read it, but your brain has to think you can later. So you want to trick it and just say, okay, I'll handle this later. You don't need to keep me awake ruminating. Put that down. Yes, I will check on that. Yes, I'll do that. And get it all out of your brain. And then if you turn on one of those guided meditation apps, if your body is that tired, now you've purged it, often you can just drift off to sleep. So
I'm just smiling at you because I remember you suggesting this, and since then I have incorporated both of those things into my life. But I remember you saying, Shellie, like, just try meditating 3 to 5 minutes. And in my mind, I'm like, meditating? Like, how is meditation going to help all this feeling and these thoughts? And I'm scared and I'm lonely. But truly, it's made a huge difference in my life.
Meditation, yes.
And so for those of you out there are a lot of apps that are free. The Calm app. I use the Insight app. And Shellie taught me long ago to just start with 3 to 5 minutes.
Yeah.
And even if nothing happens the first few times, as long as you're laying down and listening, eventually, if your body can calm down, starting with 3 to 5 minutes. Because I remember you saying 3 to 5 minutes, and I was like, I could do 3 to 5 minutes.
Right.
And now I can put 45 minutes, and truly I just drift off to sleep.
Yes, it's really nice. I mean, because I do think people think like you have to be in lotus position and sitting there, and it's no. I think one of the best times to practice it is at night when you're already tired. And although some people love to do it first thing in the morning, right when they wake up, others will do it at lunch break. It doesn't matter, but you can do it anywhere. And it's really just kind of, it's not some mystical type of thing. It's really just a way of practicing relaxing our brain, because if you think about it, how it's firing thoughts all day long. So the ability to observe yourself thinking is really an important tool, because that's when you can say, oh, you know what I'm doing? I'm ruminating right now. Whereas when you're caught in the ruminating cycle, all you can do is think about the content of what you're ruminating about. But once in meditation teaches you how to do that, like, oh, observing your mind, what are the thoughts that are going through? Oh, that's interesting. I'm doing that. Yes, letting them go. Right.
And can we talk about, there's so much we can talk about, because you've been so impactful on my life and many others. And then I now preach, therapy and meditation.
Yes.
Sleep is so vitally important. But can we talk about something you mentioned to me that really stuck with me, was that, there's negative pathways and positive pathways in our brain. Can you talk a little bit about that, like from neighbor to neighbor?
Yes,
analogy?
I do. So the neural pathways, the idea that, we've got the amygdala, the little alarm center in our brain, and often what happens is we get, the amygdala is like, woo, like a smoke detector going off in the house. It goes off and it sends a message from one pathway to another. And it can start when you're very, very young. And this is a very common pathway. You get a feeling, an alert, and it's like, oh my gosh, I need to do this. Well, this is a very worn pathway. Panic. It goes straight to that. But our brains, we know from, studies that neuroplasticity, that they are changeable. So as we start to recognize that, oh, that alarm, it's a false alarm. There's no fire. I'm sitting here in my house. There is no urgency. Then we can react differently and form a new neural pathway where, okay, I get that sensation. I don't go straight to panic. Instead, I go to breathing. Now I know I do 10 deep, slow abdominal breaths. And what I'm doing is saying to the amygdala, false alarm, we're going to go here. Now we're going to breathe, and maybe even add in some calming self-talk, which is, you're okay. You've got this. Anxiety lies. There's no danger. And you see the difference in what happens internally in your body, as opposed to if the fire alarm in this building went off right now and it was like, rear, we would all be nervous.
Yes.
Until someone walks in and says, guys, it's just a drill. That's basically what we're teaching our brains to do, is to say, it's just a drill. There's no urgency here. And why does it go off? Well, that's a complicated thing, because having a history of anxiety, when I talk to people that have anxiety now, often I'll say, think back to second grade, first grade, second grade. Were you in the nurse's office a lot? a lot of people will say, yeah, I had tummy aches. Yeah, it's a really common, yeah, same, yeah. So what happened back then is you were still having the same signals, but your little second grade body doesn't know what to do with those, and it produced uncomfortable feelings in your stomach. So you would go to the nurse because the nurse was like the safe person to go to. You go to the nurse, sometimes she'd give you like an ice pack and then send you back to the classroom.
Or tell you, I remember them saying, maybe you just have to use the restroom.
Yes.
But no, it was because my parents were divorced.
Yes.
And I was there was a lot of turmoil.
Yeah.
And so I remember going to the the secretary, and I mean, I would go sit in there often.
And just sit there, right. And probably what it gave you is reassurance, calm, and then you would go back to your classroom till the next time that it would happen. So, yeah, the thing. We think anxious children will grow out of it. They don't. Anxious children become anxious adults. So you don't grow out of anxiety. But nowadays, we're teaching kids. I mean, your kids have, thank goodness that even in preschool, like my kids were taught this song, like stop, take a deep breath, and relax. And they would learn, we would be singing it around the house, and they would learn stop, take a deep breath, and relax. And they would stomp out the ants, which are the automatic negative thoughts. Stomp out the ants, stomp out the ants. And like teaching kids at an early age, like, okay, we're gonna all have negative thoughts, but can we challenge those negative thoughts? And how can we deal with those, that feeling in your tummy? Or for some kids, it would be a headache.
Yeah.
Yeah.
I think my oldest, so this is another question, Shellie. So I feel I do have mom guilt about many things, as most of us do. But maybe worry is not the right word, but I'm very aware of my daughter and her coping mechanisms and, her anxiety. Obviously, our situation's unique because my husband had stage 4 pancreatic cancer when she was very young, and he passed away last year. But I blame myself a little bit for her anxiety because there's no question that she absorbed that energy from me.
Well, first of all, she also, I mean, the thing is that you have no control over is genetics. Okay. And you both are wired.
Yes.
There are people out there that, that's just not how they run. They don't run, I will say, they don't run anxious. They run maybe more depressed, more anxious. Sometimes it overlaps. Often it does. But so you have no control over those. The environment, yes, we do know that houses where, one or both parents tend to have an untreated anxiety, that's going to have a great effect on your child because let's say you are a worrier about safety. And every time your child goes, oh, don't do that, you could fall. Don't touch that, you could burn yourself. Don't do that. What we're doing is creating a heightened sense of danger where these kids grow up feeling like the world is more dangerous even than it is. And sometimes, as we know, the blessings of a skinned knee, the idea that you're going to fall down, you're going to skin your knee, and you're going to realize, okay, I'm okay, I can, doing that. So the difference for me is about treated versus untreated. You treated your anxiety. So now when the kids are coming to you and saying, Mommy, I can't fall asleep because I'm worrying, you may even ask great questions to say, is there something that you're thinking about or worrying about? Or teaching them how distraction is wonderful. We can read a book at night, we can say prayers, we can sing a song, we can do other things. However, we also can talk about what you're worrying about and teaching them new skills, how to deal with it. Even coloring, using, the adult coloring books are wonderful. And coloring can be a tool to deal with anxiety. It's a place that, or playing with Play-Doh and squeezing it and being out in the yard and planting stuff with them, getting their hands in the dirt. Lots of different ways that we can teach them to handle their anxiety so they've got new skills that you didn't have.
Yes.
Because no one talked about it back then.
No one. And so that's something else that I think is really important too, that I want to get the message across. And I preach this, on my Instagram and my socials, is we as parents really recognizing and having our mental health, whether it's anxiety, depression, OCD, addressing it, because if we don't, it bleeds onto the children.
Absolutely.
And then and I always say this, and maybe you can speak to this, like children soak up more of what we do than what we say.
Yes, I know. We wish not, right? We wish that they were like,
Yeah.
no, you only listen to exactly what we say. But they watch us. They are constant observers. How we feel about ourselves. I mean, there's a wonderful organization called Girls in the Know. And it was started by Lori Lander back, a long time ago. They've been around. And it's for girls going into 5th grade and their moms. And we would come together, and I would do the self-esteem night. They had a female OBGYN talk about the birds and the bees. They had a nutritionist talk about healthy body image and nutrition. And then a police officer talk about cyber safety. And so it was for
amazing.
It's awesome. Yeah, it's still around. Girls in the Know.
Okay,
Girls
we'll have
in
to
the Know.
attach
Yes.
that link too.
Yes, absolutely. And so I did the self-esteem night, and we would have the moms and the daughters come together, and we would talk about how we talk about ourselves, and how often are we with our daughters and someone would come up and give you a compliment like, Kira, you look so great, and you're like, oh, are you kidding me? And you do something, say something about yourself that was bad.
Negative, yeah.
Negative. And these girls absorb it. And so we would really work on it being positive and not being so self-critical, and working on even just taking a compliment and saying thank you, because realizing, do you want your children to look in the mirror and critique themselves from head to toe like you do?
No.
Yeah. So,
It really does matter what we say,
What
but
we
more
say.
importantly, what we do.
Yes.
So I always talk with my kids about being strong. We're feeling our body to be strong.
Right, not skinny. Skinny is not a goal anymore.
No. We cannot teach our children that. But
Yeah.
strong, fueling our body properly. And, my kids don't like when I leave, so I work out 6 out of 7 days.
Yeah.
It is, it's for mentally,
Yes.
emotionally, physically, spiritually, it's all encompassing for me. And so I
Yes.
talk with my children about how important it is not only to exercise our mind, but it also is beneficial to our mind,
Right.
too.
Yeah.
And so it is a little bit of a sacrifice on our family, because I do take time to go do
Yeah.
that. But it's how I become the best version of myself, which then in turn helps me become the best mom I
Right.
can be.
Right.
Not anybody else's opinion of what kind of mom I am.
No.
But the best mom I can be with my tools. But
Right.
I've had to fight against that.
Yeah.
Yeah,
There's a lot of judgment
Yes.
out there. Like, I hear sometimes moms or family members say things like, oh, well, it must be nice,
Yep.
to get to the gym every day. It must be nice. And, that's just such a way to shame somebody for doing something so healthy for them, which is taking care of their body,
Do you remember me calling you?
Yes.
I've called you. At one point there was a Thanksgiving I called you, and you left your Thanksgiving to talk. Do you remember that? You're like, I'm like, but my point is, we all have been shamed, and people
Yes.
are going to judge you.
They are.
And you have to create those boundaries, right?
Yeah.
Like what I know I need to do to be the healthiest I can be for my children.
Yes.
Because
Right.
everything I do is for them.
Yeah.
Truly.
And for their mom, because the best thing we can do for our children is take care of their mom.
Right.
And if you're resentful because you have not been able to work out, and for you, that's 1 hour away, but that hour pays off for the other 23
Dividends,
hours.
totally.
Yes, exactly. And you come home energized and enthusiastic and excited to see them. If you don't go, what are we showing them? Like, okay, well, mom's needs, I guess, don't really matter.
Right.
And we have to remain flexible. Obviously, I'm sure there's some times where you don't make it to a
Yes,
workout.
there is.
And
Totally.
it's challenging and you miss it, but you deal with it. And then the next day you try to get there. But
Yeah.
yeah, and even taking them, I think it's great, like some
Yeah.
of these places where you can take your kids there and they get to play in the playroom and have fun. And it's not even just like this negative thing like, okay, bye, I'm not going to see you for 2 full hours,
Right.
It's like, no, like some of these gyms that have the babysitting rooms, the kids love going.
Yes, absolutely. I have loved our conversation today. I do have a final couple of
Yes,
questions.
yes.
One, do you have a mantra that you live by? Is there any one
gosh.
thing that you would put at the bottom of your bio or the
Yeah.
top of your bio? Shellie Fidell.
Yeah, gosh, it's a good question. I tend to say this when people say, like if you're at a wedding shower and they say, what advice would you give to the couple? The advice I like to do is give people the benefit of the doubt. That's just my thing. Like I feel like most of us, we have good intentions. We want others to be happy. We want to be happy. Often there's a whole lot of stuff that interferes with that going from A to B. But if you can give, whether it's your partner, your kids, your in-laws, the benefit of the doubt, I don't know. I just feel like for me, that keeps me in a happier place to do that.
I love that.
Oh, good.
Give people the benefit of the doubt.
Give
And then
them
one
the
more
benefit of the
question.
doubt. Yes.
Shellie, is there a piece of advice someone has given you along the way that you have incorporated in your life?
Yeah, I would think for me, it is a constant challenge to set boundaries. So as when you said about taking the call on Thanksgiving, as a therapist, when you love what you do and you really care about your patients a lot, you do have to have boundaries. And so probably in the earlier days, I didn't have as many boundaries. I would probably answer calls, not that I wouldn't answer on Thanksgiving now, but I feel like I've learned over time that the same things you apply to your being a good mom, to be a good therapist and have longevity. So I'm going on, I just say over 25 years of practice, like so that I don't burn out, I have to have boundaries too. And so, you know, whatever those are. So I think I've learned from other therapists about because there were days where, yes, I was burning the candle at both ends as a therapist and as a young mom myself and as a wife and a daughter and all of those different roles. So giving yourself permission that you have to take care of yourself so that you can be there for everybody else. And part of that is having boundaries, and it's loving to have boundaries. It's not selfish. I think that's probably the best advice that I got.
Awesome.
Yeah.
Thank you so
You're
much
welcome.
for coming on.
I love how your career has just grown, and I've watched you blossom and just turn into this amazing, I mean, not just the fundraising that you've done for Sightman and Petal and all of that, but as a mom and just as a person, you're
you were a big
amazing.
part of that.
Oh,
I mean, I came to you just in shambles, really.
Mm.
And so thank you for dedicating your time and energy. And you've done lots of fun things with me. We've done mental health awareness events.
Yes.
Thank you so
You're
much,
welcome.
Shelley.
You're welcome.
Hopefully we'll do something
We
again
will.
soon.
Absolutely.
Okay.
Thanks. Okay.
Thank you to everyone for listening to the Yes We Can podcast. We will post all of the links that we talked about today. Shellie Fidell is not taking new clients, but the good news is she can definitely
I can refer you to people that
amazing
are.
people.
Yes.
So thank you again for listening, and look forward to this being posted next week.